This conference will now be recorded.
Yeah. So today we will be doing 3 stations on sexual and reproductive health. Okay. Because this is a important module where you require both communication and knowledge. So communication is also very important because this will most of the time they will be like for sterilization request or for young girls for contraception or emergency contraception or for termination. So these people require very good communication. So this module is very important. So who will be doing the first one? First case, who will be doing? Those who have done yesterday, please no. Okay, those who have not done yesterday, yes, definitely.
Can I?
Yeah. Anybody volunteer?
Can I?
Anshuja? No. Who? Shraddha. Shraddha, you did yesterday or not? I don't remember because I was not there yesterday. That's why.
Last course I did, not yesterday.
Not this time. Okay. Okay. If no one is okay. Yes, you can do. Okay. No problem.
Yeah.
So,
Next,
yeah.
I'll do Mrudula.
Anshuja. Okay. No problem. Okay.
Yeah.
Sure. Yeah. Okay. So I will start with this. I will start. This is your first slide. There are two slides are there. Okay. So once you
Okay,
finish
next
your
slide,
reading,
please.
tell me next. Okay. I will start your 2 minutes.
Next slide, please.
Next slide. Okay. 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 Sure. One. Okay. Yes. This is the only one. This is last one. Yes, your time is up. You can start.
Hello, I'm Dr. Shraddha, one of the doctor in the gynae clinic. May I check in your name and age, please?
Hello, doctor. I'm Rebecca Andrews and I'm 27.
And how do you like to be addressed?
Rebecca will be fine.
Yeah, Rebecca, I have seen a letter from your GP stating that you have difficulty in sexual intercourse. Is that true?
Yes, doctor. I'm now very much stressed about this, and my relationship is on the verge of breaking. So I'm desperate for it now. I have to do something for it.
I'm so sorry to hear that, Rebecca. I'll try to be of maximum help for you today. But will it be all right that I ask few questions to know more about your condition, then maybe examine you, and then I'll explain the options available to you?
Yes, sure, doctor.
Rebecca, can you tell me in detail about your concern?
Yes, doctor. Actually, we are married since last 5 years, doctor, and everything was fine in between us. But 9 months back, I have given birth to a baby girl, Sarah. She is now 9 months, doctor, and it was actually that delivery was a very horrible experience for me. I was in the labor for almost like in 28, 29 hours. I was
Mhm,
having severe pains. And then
mhm,
finally, they gave a large cut on me, doctor, and they stitched that area. And after that, I was never all right, doctor. Like I always
mhm,
feel that there is something is there that has not been done correctly, and now it's very painful there, doctor. I just can't touch. And what happened is after 2 months, 2 months of my delivery,
mhm,
my husband, that is John, tried to have sex with me. And that
mhm,
time it was so painful, doctor, so painful. So since that time, I have never allowed John to come. Means I never tried again, doctor. That I'm always telling. First for 4 5 months, John was also okay for that because he
mhm,
was thinking that yes, there might be some problem because of delivery. But then afterwards also, whenever he touches me, like whenever he tries to go inside, I just
mhm,
can't tolerate that pain, doctor. I just
mhm,
can't. And now John is telling me that yes,
mhm,
it's everything is in your head only. There is nothing
mhm,
there. Everything is normal
mhm,
out there. You are making some fuss and you are getting some reasons to avoid me.
mhm,
So, but
mhm.
now, doctor, that's not the truth. I love John very much, and
Yeah.
I was also enjoying sex previously, so I don't
Mhm,
want to do that. But now I'm not able to tolerate it, doctor. Yeah, and I want help for it.
Yeah, Rebecca, I can see that you are going through a lot. It must be very troublesome for you. Okay, Rebecca, can you tell me about after, how was your recovery after the delivery?
The recovery was fine, doctor. Means okay. Only thing it was painful. That
Mm-hmm,
stitches were painful for so many days, but
mm-hmm,
otherwise okay. I was normal only.
mm-hmm. So, what after where there did the stitch give way? Was there gaping of the or any infection after the cut?
No, no, doctor, no. This never anybody told me that there is some infection or something like that. But I always feel that the healing was not there, doctor. That's what I feel, doctor. But then John always tell me that no, everything is fine there.
Mm-hmm. Okay, Rebecca, and how is your baby doing?
Yeah, she's fine, doctor. No
And
problem with.
is he? Are you breastfeeding her?
Yes, yes.
Nice to know that. Can you tell me about your periods?
I started my periods 3 months back, doctor, and yes, they are
Mhm.
regular.
And when was your last period?
I think 8 or 9 days back.
9 days back. Are you
Yeah.
update with your smear?
Yes, doctor.
Mhm. And whom you are living with?
Yeah, I live with John, my husband.
Is he otherwise supportive?
Yeah, he is very much supportive, doctor. There is no problem with John, but now he is also fed up with me actually because of these reasons.
Yeah. Are you on any contraception at present?
No, doctor, because I have never allowed John to have
Mhm,
sex with me after that.
mhm, mhm. Okay. And can you tell me about your previous sexual life?
Yeah, it was totally normal, doctor. It was totally normal. There was no problem at all.
Mhm. Any referral to the sexually safe clinic?
No,
Can I ask you some personal question? Were you ever referred to the sexually safe clinic?
no, no.
Mm. And is this your? Have you been pregnant before?
No, this was my first.
Mhm. Okay. Apart from this delivery, any previous traumatic event which you had? Because certain things are reflected in the brain, and did you had any such experience?
No, no, doctor, but do you think that it's in my head?
No, no, Rubika, it is not at all in your head. I'll come to it. Just few more questions. Any other condition for which you follow your GP?
No, doctor, nothing.
Any allergies?
No,
Any surgery in your tummy or down below apart from the cut?
no, no, doctor, nothing.
Okay. And do you smoke?
No.
Take alcohol?
Previously I used to, but with my pregnancy I stopped it, doctor.
And during the last 4 weeks, have you been feeling low down or depressed?
No, doctor, I'm all right. Apart from this issue, I'm totally all right, doctor.
Mhm. Okay, thanks for this information, Rebecca. Anything else you want to add?
No, doctor, that's fine.
Okay. Rebecca, now I'd like to examine you in the presence of a chaperone with your consent. I'll ask
Doctor,
my
doctor,
nurse.
no, please, please, no, doctor. I don't want to. Nobody means I can't tolerate touch only, doctor. Please.
Yeah, Rebecca, your concern are correct. I'd like to examine from outside, and I will insert the smallest size of speculum with adequate lubrication. And if you
No,
have a
doctor.
pain at any
No,
stage,
no,
I'll stop
doctor.
it.
No, no, doctor. Please,
Okay.
please.
Okay, Rebecca, we will
No, doctor.
postpone
Please,
it for
please, please.
next consultation. Okay. Will it be all right?
Yeah. Okay, but right now, no examination, doctor. Please, please
Okay,
don't
okay,
touch me.
Rebecca, definitely, definitely. So, Rebecca, so what the condition that you have is postpartum dyspareunia. Do you know anything about this?
No, doctor. I don't know anything about this.
Okay. So, Rebecca, this is not a very uncommon condition. Many women, after delivery, especially if it is a traumatic delivery, they suffer from this condition. Okay.
Mm-hmm. Okay. But
So,
exactly
what happens?
what? Yeah, but
Yeah, I'll explain you that if you look at this diagram, this is your muscles of the down below that
mm-hmm.
that undergoes spasm if an attempt of intercourse is done. Okay, so
Mm-hmm.
it is because of the traumatic delivery you have. So
Mm-hmm.
there are certain measures which I would like to tell. First is it is good to maintain a perineal hygiene. Always avoid shampoo and always use vaginal lubricants.
Mm-hmm.
And also,
Okay.
I will prescribe you a course of vaginal estrogen because as you are feeding your baby, your certain hormone is increased, what we call estrogen, and this hormone can decrease the desire for sex. Okay,
Mm-hmm. Mm-hmm.
so I'll prescribe this hormone, which you can apply on the down below. They will
Mm-hmm.
lubricate the muscles of the down below, and they will, if it has shrunken, it will improve the skin over there. Okay.
Okay. Okay, doctor. Yeah.
Then apart from that, also if you are very busy, if you are working a lot, you can take help of your partner in certain
Mm-hmm.
activities so that you have adequate rest. And once
Mm-hmm.
you are adequate, you have adequate rest, you can try to think of that. Okay. And
Okay.
also I will fix an appointment with the counselors
Mm-hmm.
where you can, they are experienced people, and where you
Mm-hmm.
can discuss with them. It is advisable that you go with your partner there so that he also knows your condition, and
Mm-hmm.
you can he will discuss you can acquire certain position may be painful, so you can
Mm-hmm.
acquire a different position and you can try on that would be a great help for you. Okay.
But I always feel that, doctor, there is something down, there is problem there with me. So how means how I can come to know that there is no problem? So how you can tell that there is no problem, doctor?
What problem do you feel, Rebecca?
I always think that there is something with the stitches, and because of that, it's blocking it, doctor. It's not allowing
Okay.
my husband to enter
Okay.
me inside, and it's causing me
Okay,
the
I will
pain.
also, yeah, I will also refer you to the counselors. They are specialized people. They will tell you about vaginal trainers. There are certain vaginal trainers. First, they will give you the sensate. You can try it around the skin, and then you can slowly insert the finger around the opening, and then you can use the smallest dilator. Once it goes inside, you can put the
Shraddha, time
larger
is up. Time is up, but yes,
diameter.
continue. Finish your station within next one
You
minute.
can insert the larger size dilators, and once the adequate size dilator is able to go, you can try sex with your partner. Okay. Whatever information I have given you, I will give you the leaflet for it of our
Mhm.
trust so that you can know more about the condition. Also, I'll write back to the GP about our discussion. Do you have any other queries?
No, doctor. No, doctor. Fine.
Yeah, and I'll refer you to the physiotherapy also, and there are support group also where people with similar condition with whom it will be good experience if you talk to them. Okay, thank you for your time.
Okay. Okay. Thank you. Yes. So thank you, Shraddha, for this station.
Thank you,
Mm,
Thank you so much, Dr. Mrudula.
So Shraddha, the basic point was history was too prolonged. Okay, otherwise, I think you could have managed the management very well, but the history was somewhat prolonged, like 6.5 minutes. You were 6 minutes almost. You were taking the history. Okay, so
Yeah.
because of that, yeah, because she was talking so much, I I can tell you that yes, here the role player was talking too much. That means she is very anxious, correct?
Mhm.
She is talking too much. That means she is very anxious. And what the major concern what she have is, so you have to identify these two concerns. Okay, so first one is that she feels that there is something there in her speeches, okay, in her
Mhm.
episiotomy, that she's uh, that she is thinking that there is something, because of that she is not able to have the intercourse. Okay, that is that episiotomy problem is responsible for her problem. Okay, that is the one thing. And second thing, her husband is telling that it's there in your head, there is nothing there. Okay, and she wants that assurance that no, I'm not having any psychological problem. So
Mhm.
basically these two things she wants reassurance of. Okay,
Mhm.
now so either history wise template, history you took almost very well, Shraddha. Okay, only thing it was prolonged, but otherwise you took very well history. Only thing what you have to ask is healing. You ask nicely, whether it is primary or secondary, that I only told because it is at the entrance only. Okay,
Yeah.
so that I only told. Now you have to ask her whether she has got any smears or tampons. Okay, so you have to ask whether she had any smears or tampons after delivery. Okay, so that means whether it was possible or not. Okay, or any precipitating factors. Contraception you ask. Partner views you didn't ask, Shraddha. Okay,
Mhm.
so here in
I could not
partner
get you.
views, yeah, partner views, I will tell you exactly what you have to ask. So what you have to ask her is, so yes, first intercourse was very painful or traumatic for her, correct? So that was her precipitating factor, correct?
Mhm.
Till that time she
Mhm.
was not aware of this problem. So first intercourse was a precipitating factor here, and that was a traumatic experience. So now here you have to ask her, so have you ever talked with John about this problem? Have you ever tried to talk with John, okay, regarding this problem? And next thing is, where have ever John did some this did some what you can tell, where he has forced you sometimes to have sex. Okay, whether he has forced you any time to have sex after the delivery, after this episode. Okay, because that
Okay,
again
doctor.
can become a traumatic experience for her. Okay.
Yeah.
Hmm? So this is the thing. Then that is the same. That is any sexual abuse by partner afterwards. And in case of primary, now this is not primary dyspareunia, but for primary dyspareunia, always remember, ask about child sexual abuse. Okay. Yes. So yes,
Yes.
history wise, you were very good. Now, once it comes to the management or counseling part, so you just prescribed in one sentence that she is having this vaginismus. But now here she wants the reassurance. And before that, when you ask regarding examination, she was furious, correct? She was not allowing you to examine her. Okay. So now how you can negotiate that? Because you have to negotiate that. Unless you see her stitches, how you're going to know that they are healed or not? Whether there is any granulation tissue, whether there is any scar formation, keloid formation. How you're going to know that? Correct?
Yeah.
Unless you examine her, how you're going to know that whether it is a organic or whether it is a functional? Correct?
Yeah.
Yeah. So for that, you have to examine her. Now she is telling you not to examine. Now you have to respect her wishes also, but you have to fulfill your job also, correct? So now how you can negotiate this problem is, so you can here ask her, okay, okay, Rebecca, I can understand your concern because of this, definitely, but can you please, I will try to be as gentle as possible. First, tell this sentence, okay? If she okays, no problem. Now she was not okay with this also. Okay. Don't tell regarding inserting any speculum or something like that right now. Okay. Hmm? She then once you tell her that I am going to insert smallest specula, then she will never allow you. Okay. Yes? Are you getting me? Hello? Am I audible?
Yes.
Yes.
Yes, you're
Okay.
audible.
Yes, yes. So never tell her that I will try to insert a small speculum or something like that. But tell her that, yes, Rebecca, I can understand your concerns, definitely. But it is also important for me also to see if there is any problem with your speeches. So what we can do today is I will just try to have a look. Okay. I will just try to have a look of that your area. Okay, so I can see if there is any problem with your speeches. Okay, if there is any major problem with your speeches. Okay, so that you will, and if you have told that sentence, I would have told you the examination findings also in her case, that there is only minimal granulation tissue is there, otherwise the episiotomy stitches are healed healthy. Okay, so here the thing is that you have to tell her that yes, I will try to only inspect. I will try to have a look, okay, at that area, and so that I can understand if there is any major problem with the speeches. Okay. And then once she allows for that, and that too also you have to tell if you allow me. Okay, so once now you take her into the confidence, now just examine, or that means only inspect her, and now you can tell her that yes, Rebecca, your stitches are good, they are healed properly, there is no major problem with stitches, but I can understand your condition, it is not inside your head, there is no problem, there is nothing like the John tells, there is nothing in your head, this is a very real problem. Okay, it's a real problem, and it's the way you told vaginismus was correct. Like it is the muscles around your vagina or muscles around your down below are going into the spasm with slight touch only. Okay, this is the real thing occurring, and this is because of some past traumatic experience and your delivery experience, traumatic delivery experience. Okay, but yes, there are treatment options available, and you can definitely can have or enjoy the sex as before. Okay, so how you can now how you can convince her is, so yes, Rebecca, have you ever tried mirroring yourself? Okay, because you feel that there is some problem in your stitches, so try to mirror yourself first, so you can see that there is the area there is absolutely normal. Hmm? Try to mirror yourself, and along with that try to fingering that area yourself, and you can use some lubricating or numbness cream. For that you can use those creams first, and you can use that creams, and you can try fingering yourself, and once you are comfortable with that, we can give you some specific dilators or trainers. So they are starts from very small size, so you can try to insert them yourself. We will teach you how to do it. Okay, and you can gradually increase the size, and you can see that nothing any size your vagina can accommodate. Remember well, Rebecca, if the baby can come out of that vagina, then it can accommodate any size of penis, so don't worry regarding that. Okay, just we will try to teach, okay, or desensitize, we call it as desensitize. Okay, so that that fear of that traumatic experience will go, and for that we will arrange one meeting with counselor also. Okay, and I will advise you to attend that meetings with your husband, so that he will also know regarding that condition. Okay, so here you are telling everything. Hmm? And
Yeah.
then yes, and also I will refer you to the physiotherapist, so they can teach you this muscle exercises, pelvic muscle exercises, so you can have control on that. Okay, control on your muscles, and also this vaginismus or this spasm can be avoided. Okay, but till that time, Rebecca, please don't indulge in penetrative intercourse. Okay, but yes, definitely you maintain some physical intimacy with your husband. Okay, so that slowly you will get ready for sexual intercourse. It will take time, but don't worry, it is always possible. Remember that. Okay, so I will give you some information leaflets and support group also, and I will fix an appointment with the counselor. Okay,
Yes. Yes. Thank you,
you got
Dr.
it.
Mrudula. Yes,
Yeah.
got it.
Yeah. So how
Thank you
you're
so much.
Yes, thank you. So even for primary dyspareunia also, you are going to, this management will be almost similar. Okay. Like whenever they are not able to consummate their marriage also, in that case also, the management will almost similar. Okay. Only thing here that speeches and this thing will not come. And sometimes when there is problem with episiotomy, like any keloid or granulation tissue, where you have to tell her regarding refashioning. Okay, so that in that case you have to tell about the refashioning also, but then you have to tell her that this refashioning will not always guarantee that it will heal properly. Okay, there are chances, because it is usually a body reaction that how the scar will form. Okay.
Yeah.
Yeah. Okay.
Thank you, Dr. Mrudula. It was really a tough topic for me. Thanks for clearing it. Thank you so much.
Okay. Okay. Any doubts? Okay. Shall we move on to the next? Yeah. Anshuja.
Dr. Mrudula, I'm sorry, just one small question. How do we
Yes.
ask about sexual abuse sensitively?
Okay, childhood or something. Okay, how you
Yes.
can ask her regarding this is, so Rebecca, do you anytime remember any traumatic experiences in your past? Can you get reflashes of this, or some? Do you have any memories that some incidences, like some traumatic incidences have occurred you in your past, occurred to you? Okay, regarding this sexual activity, you can ask here directly. Okay.
Okay. Okay. Thank you.
Yes, definitely signpost it. So I'm going to ask you some important but personal questions, but it will be helpful in your further management. So try to answer this. Is it okay with you? Okay. So
Yeah.
first
Thank you.
signpost it, and then you can ask directly, no problem. Okay.
Sure. Yeah. Thank you.
Yeah.
Dr. Mrudula, what about Botox injections and gabapentin? Does they have a role in this?
Gabapentin for vulvodynia. So you have to ask it, just it is just before, just during sex, or the pain is always there. So gabapentin is for vulvodynia. It is not for dyspareunia. Okay.
Okay, what about Botox injections?
Botox injection and this thing, you can usually see Botox injections are not approved. Okay, for such use. Yes, steroid injection, if there is keloid formation is there, then you can tell about steroid injections. Okay. But Botox
Okay,
injection is not approved for that, at least in UK. Okay. But yes, you always tell if the keloid is there or any scar tissue is there, prominent scar tissue, you can talk about steroid injections. Okay. In that scar itself. Okay. Yes. Okay. Shall we move on to the next? Yeah. Anshuja, you wanted to do, no? Next. Anshuja, are you there? Hello. She's not there. Anshuja? Yes. Okay. She's not there. Anyone else who wants to attempt next station?
Can I do, doctor?
There are two. Who are? One is?
Can I do,
One is
Dr.
Razia.
Mrudula?
now third one is one is Razia, one is Salma. Okay. And third one Amita was there. Okay.
Yes,
Razia.
ma'am.
Okay, so sorry, Salma. You have done so many with me, so I will give chance to Razia and Amita. Okay. So yes, Razia.
Yes, doctor.
Yeah. Okay. So this is your station. I will start your 2 minutes. There are 3 slides, I think. So just once you finish, tell me. I can move to the scroll on to next slide.
Okay, next slide. Is there any more slide or this much only?
One more slide is there. Should I go to the next
Yes, yes, doctor.
one? Yeah, this is the last slide. Yes, your time is up. You can start.
Okay. Hello, I'm Dr. Razia, one of the doctor in the gynae clinic today. May I confirm your name and age, please?
Hello, doctor. I'm Haiti Buckingham and I'm 34.
How may I address you?
Haiti will be fine.
Okay, Hetty, as I have seen the letter from your GP that you are having bleeding between the periods and you have come here for further management. Is that correct?
Yes, yes, doctor.
May I know, Hetty, what is your expectation from today's meeting?
Yes, doctor. Actually, basically, I don't know why this. Previously, I was totally normal, and this has started since last 1 year. I don't know. It has become quite troublesome for me, and I want to get rid of it. And I think I want to change my this thing also, like birth control pills. Also, I wanted to change, doctor. So this was my basic problem.
Okay. Okay, Hattie, is it okay if I can ask you a few questions to know more about you? Then I may examine you and then run few tests and then we can make together a management plan.
Yeah, sure, doctor.
Okay, Hattie, can you tell me a little more about your concern, like about your bleeding, since how long you have and
Yes, yes, doctor. So the doctor basic, this problem started 1 year back. I'm having this bleeding in between my periods. It's not too heavy, doctor. Sometimes it will be just like spotting. Sometimes it will be like 1 or 2 pads. But I can't tell when I will get that bleeding. And it is there is no pain or something like that. But just I'm not sure when I will bleed. So I have to be always ready for that. And it is causing me. It is giving me some stress, doctor. I'm not able to handle that. And I don't know. Actually, I'm on pills, doctor. I'm using pills since last so many years. I just remember I'm using since last I think 12 or 13 years the pills.
okay,
But
okay.
never a pill was there that was causing me problem. My GP is telling me that it is because of pills. But I'm in that habit since last 12, 13 years. So, and the problem started recently only 1 year back.
Okay, okay, we will look into that. And what about your periods? Are they coming regularly?
Yeah, otherwise my periods are regular, doctor, every monthly.
Mm-hmm. Okay, and when was your last period?
It's 12 days back.
12 days back. Okay, and do you have any problem with the urine, water work, and bowel problem?
No, no.
Any pain during the periods?
No.
Mhm. Okay, and have you been pregnant before?
Yeah, I have one boy, doctor, Alex, 4 years.
How was your delivery and post delivery?
Delivery was normal, doctor. There was no problem.
Okay, that's good. And are you following with your GP for any medical concern?
Yes, doctor. Actually, I'm get means recently I have started having fits, doctor. So for that, I am going to my GP and I'm on tablets, doctor.
Okay, fits. Which tablet you are taking?
I think it's carbamazepine, doctor.
Okay, and since how long you are taking this?
I think almost 1.5 year back it started, doctor. Yeah, since that time.
Okay, okay, fine. And your fits are well controlled?
Yeah, with the tablet it is well controlled.
When you saw last time your neurologist?
I think 2-3 months back.
Okay. And what about your contraception? You are using the pills, right? Okay. And any condom, anything you're using, something else for protection of the infection?
No, doctor, nothing.
And your smear is up to date?
Doctor, yes, actually my last smear was 3 years back. I'm due now, doctor, for smear.
Okay. And any surgery in your tummy, lower below?
No.
Any particular concern in family?
No.
Any allergy to any medication?
No, doctor.
Okay. Do you smoke cigarette, Hattie?
No.
Drink alcohol?
Yeah, sometimes, doctor.
Any recreational drugs?
No.
Okay. And are you aware of your weight to height ratio?
Yes, it is 23.
Yeah. Okay. And what you're doing for living?
I work as a assistant in a private firm, doctor.
With whom you're living?
I live with my husband.
Okay. Fine. Okay. Fine. Okay, Hattie. Is there anything else you would like to add in your history?
Yes, doctor. Actually, what happened is, means I told you, I want to change my pills, doctor. Because what happened recently, I don't know why, but since last 1.5 year, I'm missing my pills, doctor. Somewhere I'm forgetting to take my pills sometimes. So always it is like in the month I forget at least 2-3 times. I don't know why it is happening, but it is started recently only.
Because what I can understand from your history, because you are taking carbamazepine, maybe your contraceptive effect is not that well controlled, that well working, and that could be the reason that you're getting spotting in between. So that is good idea that we can change your contraception. That will be good idea.
Okay,
And
thank you.
yeah, and then your examination, as it has been done by GP, that there is no abdominal examination is normal, and she has seen your neck of the womb, that was even normal. So coming to your concern that bleeding, so what other contraception you would prefer? There's other, like we can in your case, because you have this carbamazepine, so better if you can use copper IUCD, that will be good idea. And we can give you even the marina coil, that is a hormone one, that will even prevent this intermenstrual bleeding. And even you can take the injection Depo-Provera in your muscle, that can be good idea also.
Okay, but doctor, what can be the cause of this? Means it is only because of forgetting the pills, or just because of this medicine? That means, is it not
it could
cancer,
it could
doctor?
it could be both. It could be both, because you are missing the pills, and plus you are taking this carbamazepine. Because of this carbamazepine, efficacy of the contraception reduce. So that could be the one reason, and plus you are even in between, you are missing the pill, so that could be another reason. So in that way, it's better you use some proper contraception. So if you put this loop, it will prevent the habit of forgetting. So you won't be, you don't have to be worried to remember it every day, and then it will even improve your bleeding also.
Okay.
Yeah,
Okay, doctor.
and this,
Yes.
yeah, if you want the copper IUCD, that we can put it, and that will be put by expert. And it has some little risk that while putting it, you can have injury to the neck of womb and sometime hole in the womb, but we will make sure it is done nicely. And the hormone one is also available, you can use that also. Or if you want the injection, that injection we can also give you. So you can whatever you choose, we can help you in deciding.
Okay, doctor. But yes, but I'm worried about this bleeding. Means there is no other cause for this bleeding, no, doctor? It is just because of pills?
Because the cervix has been checked and they said it's fine, and you are again due for the this one pap smear, and we can arrange one ultrasound for you to see your womb, your ovaries, and your tubes. Sometimes could be some the what is called a fibroid, that is smooth muscle swelling, that could be the cause that can give you some bleeding. So we need to do even one ultrasound to see your womb also.
Okay, doctor. And you told me regarding these methods, no, like coils and this thing, they're
Yeah.
perfect, doctor. They are perfect, means there are no chances that I will get pregnant with this.
Yeah, they are 99.9% effective. So if you use it, yeah, they are 99.9% effective. But there is small chance that you may get pregnancy outside the womb, and there is small chance that very few cases even can get pregnant also. But 99.9% it is effective, and you can keep it for 3 year or 5 year.
Okay, okay, doctor.
Yeah,
And doctor, can I go for this thing, operation?
which operation?
To means I don't want any more kids, doctor. So can I go for this sterilization operation?
You have only one child, and maybe you may need to change your mind and you want child later on. This loop is long acting, so anytime if you want, you can keep it for
But
5 years,
doctor,
and
actually,
then
we
if
are sure regarding that we don't want.
but you are quite young, maybe in later on you may need to change your mind. So even if you tube the you want permanent sterilization, this your bleeding may still be there because of you are taking this carbamazepine, and first we need to rule out the cause of your bleeding, and then if you want, I can fix your appointment with the consultant, and then you can discuss. But for me, like what I recommend, that you are still very young and you have one child, so better if you use this long-term contraception, this loop, this will be better. And if you want, there's something called implanon that you can, small rods you can put in your muscle, that will be helpful. It will prevent pregnancy and not that much side effect.
Okay, and will this not cause bleeding, no, doctor, like these pills?
uh, which pills?
Like I'm getting now the in between, the bleeding is there, no? So it will not cause any bleeding, no? Like these injections or coils will not cause any bleeding in between.
And they can cause, still they can cause, because they are progesterone, sometimes they can cause intermenstrual spotting. Still there is chance that you may get, and it is hormone, you may get even some hormonal effect like bloating, weight gain, and even acne. There are small risks are there, but usually like it will be better.
Yeah, yes. Okay, time is up. Yes, finish your statement.
Yeah, so I will give you information leaflet about the long-term contraception, and I will give you the support group number and contact number, and I will fix your appointment with consultant if you want to discuss further about management.
Okay, sure, doctor.
Thank you, Hattie.
Shobha, please mute your mic. Hello, Dr. Shobha, please mute your mic. Hello, please mute your mic. It will disturb. It is disturbing all. Yeah. Okay. So Razia, what do you think regarding your station?
I don't know, I got little confused, like actually, yeah, management, I could have speak something better.
Yes. Okay. Okay, we will go step by step. There was something in the management that you should have done better, definitely. I will tell you how to go regarding that. Okay, actually, you tried to tell everything. Okay, but it was just, if it would have been little organized, no, it would have been better. Okay.
Yeah, doctor,
So,
thank you.
yes.
Thank you.
So this is an intermenstrual bleeding. No, I know it is somewhat odd station. We don't expect such stations. No. So see, intermenstrual bleeding means, first in the history, you elicited almost all history. Good that you elicited this history of carbamazepine and epilepsy and all these things. But do you ask her which pill she's using? Okay. And that forgetting the pills, I only told you. You have to ask when she's complaining of any intermenstrual bleeding on pills. Okay, so you have to ask regarding the miss pill. Okay. Hmm?
Oh,
Because this
yes,
is
yes,
the
doctor.
most
Yes,
common
doctor.
cause. This is the most common cause when she is taking any hormonal contraception. Miss pill will be a most common cause of this intermenstrual bleeding. Okay. Another cause will be cervical ectropion for because she is on hormonal contraception. And which pill she is taking, whether she is taking just OC pill, whether she is taking progesterone pills. Okay. Is it important? Because POPs, progesterone only pills will cause definitely this intermenstrual bleeding. Correct? So you
Yes,
have
yes,
to ask
doctor.
regarding which pill she is taking, and since when she is taking, whether she has changed recently the brand of the pill or something like that. Okay. So you have to ask, and whether how she is taking, whether she is taking regularly or not. Okay. So all these things you have to ask. Nice that you elicited the history of epilepsy. That was a good thing. Now the next thing is you have to ask her regarding any postcoital bleeding. Correct?
Yes,
Now
yes.
she is
I think I asked after intercourse any bleeding, or
you asked.
I was
I don't remember.
I was assuming. I don't know. I don't remember.
Don't assume anything. Okay, I think you have not asked. I also, because I don't remember telling you the answer. Okay, so always whenever she is complaining of any intermenstrual bleeding, you have to ask regarding postcoital bleeding or any contact bleeding. Okay, that is one thing. Now next thing in the history, what she has to ask, whether it is affecting her quality of life or sexual life. Okay, that sexual life you have not asked, correct? Yes, whether it is affecting her sexual life, that intermenstrual bleeding. Next thing,
Yeah. I did not ask.
any vaginal discharge. Most common cause of intermenstrual bleeding is chlamydia infection. Okay, so you have to ask regarding any vaginal discharge or any sexually shared infections. Shobha, Dr. Shobha, please mute your mic. Hello, I can't mute. 1 minute. Yeah. Okay. So that is the thing that you have to ask regarding vaginal discharge or any sexually transmitted infections. Okay. History of any multiple partners for that matter. Okay, you have to ask for that also. Now, next thing you have to ask is smear history, that you ask contraception. What I was thinking is missed pill you have to know, and regarding which pill she is taking, any treatment she has taken so for this intermenstrual bleeding. Okay, and wishes of future fertility. Correct. That you have to ask her, because depending upon that you will know the contraception you have to offer her. Correct.
Okay.
So you
Yes.
have to ask
Yes,
for this
doctor.
wishes for future fertility also. Then other history template that you completed correctly, no problem. And she only told you that she wants this change of contraception. Now you have to ask her why she wants this, because she was comfortable with the pills. Correct. Now why she wants it, change of contraception. So what are her
Yes, doctor.
concerns
Yes.
for that? So for the concern for that, because she was forgetting, correct? So that's why she wants reliable contraception, that she should not forget. Now, so once you ask the history, now see, GP has examined her. That means it doesn't mean that you should not examine her. Okay, you have to examine her.
Okay, doctor.
For that thing, you have to tell her that yes, I will examine you in presence of chaperone. I will see for your weight, height, okay, and I will see your tummy, and then I may have to look you from the down below also. And there, if anything found suspicious, I can take some swabs also for STIs, okay. For the STI screening, or I can, if any problem is if any problem is there with neck of womb, I may take some smear also, okay, because she is due for smear. Actually, she should go directly to the screening. Okay, for smear, she should report the screening. But if you find anything suspicious, you can take smear in the gynecology clinic. Okay, if anything is suspicious is there. Otherwise, she should go to the routine screening program for smear, because now it is HPV, correct? So she should go to the routine screening program. Now the management is concerned. So first, now you directly went on to the change of contraception, Razia, correct? Now her basic concern is
Yes.
intermenstrual bleeding. And next she wants change of contraception. So first you have to go for this intermenstrual bleeding. What are the causes? Okay, what are the causes? You have to know that, you have to tell her. So yes, Haiti, your concerns are valid. Usually this bleeding occurs in your case. Most probably the reason can be, as you told, it is maybe because of missed pills, or sometimes this carbamazepine reacts with these pills and it decreases its effect. Okay, efficacy, and this thing, don't use those jargons. Okay, so this carbamazepine can decrease the effect of this OC pills, and because of that your hormone levels may fluctuate and you get the bleeding. Okay, So this might be a major cause in your case, but yes, there are some other causes for this bleeding also that we have to see if that we have to rule out that these major causes are not there, like any sexually shared infection, any some small growth will be there inside your neck of the inside your womb. Okay, we call it as a polyp. Okay. So in the lining of your womb, there might be a small growth. It is called as polyp. It is not cancer, don't worry. But sometimes if it is there, it may also cause this bleeding in between your periods. Sometimes there can be problem with your neck of the womb also. Okay, there your neck of the womb may have some slight ulcer. Usually it occurs with pills. Okay, or some polyp also, cervical polyp, that may also cause this intermenstrual bleeding. So you have to tell her the causes of intermenstrual bleeding. And the next thing is, remember, for intermenstrual bleeding, ultrasound is not recommended according to recent guidelines. For persistent IMB, you have to do hysteroscopy. Okay, according to recent NICE guidelines, you have to do hysteroscopy. Okay. So first, what you now you are not directly going to the hysteroscopy. So for her right now, what you will be doing? So what we will do, what we can do here is, yes, we can change these tablets. Okay, we can change these pills, and we can start you on another contraception. Okay, and if we can see whether this decreases your this bleeding problem, and also we will take some tests to rule out this any sexually shared infections. Okay, and if it doesn't get better with this, then we can do a small camera test and we can see the inside of your womb if there is any small growth is there. Okay, and very rarely the cause can be cancer also. Okay, but it is very rare. But yes, definitely we would like to exclude that also if your bleeding doesn't respond to our this change of treatment. Okay, got it? So now henceforward you have to talk regarding this contraception. So because you are taking this carbamazepine, some contraception is not, some birth control measures are not suitable for you. See, implant is not suitable, progesterone only pills are not suitable. Okay, because enzyme inducers have effect on implant also, and progesterone pills also. So for her, options are copper IUD, LNG, that is Mirena, and another is DMPA. But here you have to tell her that DMPA, there is with DMPA there will be risk of some intermenstrual bleeding will be there. Okay, but usually it is normal with DMPA, and after some time you will get very less bleeding. Same with Mirena. Okay, but with the DMPA, the IMB and erratic bleeding will be more with DMPA. Copper T will not have such intermenstrual bleeding. So all these things you have to tell, failure rate of each you have to tell. Now when she asks you regarding the sterilization, so now don't at the outset don't deny her that option. Okay, for any option at the outset only don't deny or don't refuse for that option. But you can tell her, yes, sterilization is also a good option for some women. Okay, but as you have only one kid, Betty, it's better you can opt for another contraception that will be a long acting, so that you need not take it daily, so the forgetfulness will not be a problem there. And if you change your mind in future, then see, because if you undergo this sterilization operation, it is irreversible, or it is a permanent method. So if the reversal is also available, but the chances of success are somewhat decreased, and also it is not available on NHS. So definitely it is what we have to, you have to tell her regarding sterilization, that regret and reversal will be difficult. So for that matter, better you opt for any other contraception, but don't tell her that I recommend. Don't use this word. Okay, never use this word that I recommend. Okay, what I feel better for you is,
Okay. Okay,
definitely
doctor.
finally your wishes will be respected, but never use this word that I recommend for you, because see, every time it will be final choice will be of patient. Okay, you have to just give her all the options. So never tell that I recommend this, but yes, give her all the options. And yes, someone has raised a very good point here. I think, yes, we have to rule out the pregnancy also. Okay, so definitely we have to do a pregnancy test. Okay, and then we have to do for all this test. Okay, So got it? How you're going to counsel her regarding the contraception. But first address her issue of IMB, intermenstrual bleeding. You have to address first, and then you have to go for the contraception. Got it?
Yes, doctor, but she had period 1 week back, so still we will do during pregnancy test?
See, with this, so for that, she is on pills, and that too she is forgetting, and that too she is on enzyme inducers. So you have to ask for her period also, whether it was a normal like before, okay, or any less bleeding or something like that. Always it is better because she is on enzyme inducing drugs, no? So it is better to rule out this pregnancy, okay, because definitely it is going to decrease the efficacy, and again on the top of that she is missing her pills. Correct?
Yes, doctor. Thank you. Thanks a lot.
Yeah. Yes.
Hello.
Yes.
We will not offer her ultrasound because ultrasound will rule out if there is any pregnancy or ectopic pregnancy or polyp. So we'll do camera test first, means hysteroscopy first, or ultrasound first.
Ultrasound is not routinely recommended for intermenstrual bleeding. According to NICE guideline, for intermenstrual bleeding, hysteroscopy is the first line of investigation. Because according to them, both is the same. Outpatient hysteroscopy and ultrasound, both are the same. Okay.
Yes.
Yeah. So for intermenstrual bleeding, or whenever they feel like there is some pathology inside the endometrium or inside intracavitary pathology, they always recommend this thing, hysteroscopy, in preference to the ultrasound. Okay. Yes. Okay. So here ultrasound will not be the investigation of choice. If she requires any investigation, that is STI screening, and another thing, so first pregnancy test, STI screening, and third thing will be hysteroscopy. Okay, but hysteroscopy after giving this thing, that is changing her contraception and STI screening, and after that, if the IND persists, then you are going to offer her hysteroscopy. Okay, and smear also, because she is due for smear.
Doctor, if she is not responding with change of the medicines, so she may require like sampling of the endometrium.
Sampling of the endometrium will depend upon the pathology you are finding inside. Okay, like you do the hysteroscopy, if you get the polyp resected, if you find something like abnormal endometrium, abnormal growth, try to sample it. But not routinely. Biopsy is also not advised. But yes, if it is not responding, definitely hysteroscopy. Blind biopsy should not be done. Okay. Only postmenopausal bleeding you can take fetal biopsies. But who is menstruating, you have to do the hysteroscopy and then take biopsy, not blind biopsy. Okay. Blind sampling of endometrium should not be done for the people who are menstruating.
Dr. Mrudula, we can Dr. Mrudula, we can offer her implant also in epilepsy.
Implant, no. Implant because it reacts with enzyme inducers.
Yeah,
Implant.
true. But I also thought like that. But once a few days back when I checked it in the UK MEC, there it was. I think they have written it now. Implant can be given, and the same is in the Oxford also.
No, but how you can give? When if it is reacting with this enzyme inducer, then definitely it is decreasing the efficacy, no? See, in the epilepsy guidelines also, they have not recommended implants. In the epilepsy guidelines, these are recent ones. They have also not recommended implants there.
But the UK MEC they have, which came last year, there I think, I may be wrong, but I checked it and then I came to know that in epilepsy we can give implants also.
In epilepsy is different thing, dear. Epilepsy is different thing. Epilepsy on enzyme inducers then?
Okay, maybe that could be the mistake.
Yeah, because epilepsy, there are so many different drugs are available. If it is non-enzyme inducer, you can give anything. Correct? You can except lamotrigine, you can give anything. Except ocipis, you can give anything. If she is not on lamotrigine, you can give anything. Correct?
Yes, true.
If she is not on enzyme inducers, so there is no restriction for contraception. Okay? Yeah. So here implant is not advised because she is taking carbamazepine. Here see only 3 choices are there. One is the DMPA, but again DMPA will cause intermenstrual bleeding because it may cause erratic bleeding, correct? The Mirena, yes, Mirena, but we can tell her that only for around 6 months to 1 year, it will cause some bleeding, and then otherwise it will be a normal thing, or you will have less bleeding. So Mirena can be given, copper IUD can be given. DMPA, we have to tell her that it can cause some intermenstrual bleeding. If that is a major problem with her, then better not, means just you have to offer her, but then you have to tell her that. Got it?
Yes, thank you, doctor.
Yeah. Okay. Yes. So shall I move on to the next?
Hello, doctor.
Yes. Please,
Can you
Dipti.
please tell about how to ask about history of any new partner or multiple partners? How to put it in words?
Okay. So always first signpost. Okay. And are you in a stable relationship? First of all. Okay. Are you in a stable relationship? So she will either tell yes or no. Okay. And do you have any history? Like, do you have any other sexual partner than your husband or your regular partner? Okay. You ask directly. First you signpost it and then you ask directly. They will not mind. They will not mind in UK. Okay.
Thank you. Thank you.
Yeah. Yes. But always signpost. For sexual history, always signpost it and then ask. Okay. Yes. Shall we move on to the next? Okay. Next, who is doing? Amita. Correct?
Yes, ma'am.
Okay. So, yes, this is your station. Whenever you want to change the slide, please tell me. I will start your 2 minutes.
Yes, ma'am.
Okay. Should I change?
Yes, ma'am.
Okay. This is the last one. Yes. Your time is up. You can start.
Hello, I am Dr. Amita. Can I confirm your name and age?
Hello, doctor. I'm Tracy. I'm Tracy Fraser and I'm 15 years.
Good to meet you, Tracy. Tracy,
Thank you,
I have
doctor.
come to know that you want termination of pregnancy. Am I correct?
Yes, yes, doctor.
Tracy, would you like to tell me more about this pregnancy?
Yeah, but yes, doctor. Only thing that I want to know that you will not tell my parents.
I assure you that whatever we talk will be fully confidential, and without your permission, I will never tell it to anybody. Is it good, Tracy?
Yeah, doctor. Okay, thank you. Thank you for that, doctor. So, yes, doctor, I have missed my periods. I think 2 day, I think 14, 15 days are over, doctor. And I have started getting vomitings and this thing. So, I got my pregnancy test done and it came positive, doctor. So, I don't want to keep
Tracy,
this
can you be a
pregnancy.
little louder, please?
Yeah. Yeah. Can you hear me?
Ma'am, it's now clear. It was
Okay.
interrupted in between.
Okay. Right now it is clear?
Yes.
Yeah, okay. So, yes, doctor, actually my periods was missed and I was overdue by almost 14, 15 days, doctor. And I started getting this vomitings also. So I did my pregnancy test and it came positive. But doctor, I don't want to keep this pregnancy. So I'm here.
I'll help you, and I will support your decision also. Have you told somebody about this pregnancy?
No, no, doctor. I don't want anyone to know regarding this. No.
Uh, who's your partner, Tracy?
Yes, he is my boyfriend, doctor.
And what is his age?
He is, I think, 16 years.
Okay. And have you told your partner about it?
No, doctor. We recently had breakup.
Okay. And what about your parents?
No, doctor, that's what I'm telling. No, I don't want to tell. You should not tell my parents also. That's why I'm asking you again and again, doctor. Please do. I don't want
Tracy,
anyone
I
to know.
assure you, I will not tell your parents. But is there any reason why you don't want to tell your parents?
Yes, doctor, because they will not approve this, doctor. They're very strict, doctor. They will not. They will just abandon me, or they will just I don't want to tell them. No.
Okay, if you do not want to tell them, I will respect your wishes. But Tracy, I think so. If you tell your parents, because they also have a right to know about what is happening in their child's life. So if you consider, you may tell them, it is always good because then you will have people who will be
But
standing
doctor,
by
as I
you
told
in
you,
all
no, doctor.
thick and thins. Okay, Tracy.
No,
Tracy,
doctor.
do
They
you
will
have
not
any
stand by
other
me. Yeah.
Tracy, do you have any other boyfriends besides him?
No, no.
Okay. And do you have any pain or abnormal discharge or any other complaints prior to this?
No, doctor. Nothing.
And have you ever visited the sexual health clinic?
No.
And have you ever used any contraception?
My boyfriend was using condoms. We were not used to have frequent sex, doctor. He was my recent boyfriend only. Like I was in relationship since last 6 months only, and we had sex very infrequently. And he used to use condom, doctor. I don't know how I got pregnant.
Okay. Condom is a very good method of contraception and it prevents against all infections also, which are sexually transmitted. But it has a high I would recommend that you use some reliable contraception, which can be in the form of uh, uh, some other things. If you want, I will give you some information leaflet about it also. Is it clear?
Yeah, okay, but right now I had breakup, doctor, so there is no question of any sex. Henceforward.
Okay.
Yes,
You
Dr.
have never
Amrita,
been pregnant before?
no,
Okay. And are you allergic to anything?
no, doctor.
And your cycles are regular?
Yes,
Okay. And there is no foul smelling discharge or any other problem?
no, doctor.
And have you had any operation earlier?
No.
Okay. And uh, how's your school and your friend circle? Is it supportive?
Yes, doctor. Yeah, it's very much
Okay.
supportive.
Okay. Tracy, I will also examine you and would confirm your the size of your uterus and would be examining you in presence of a chaperone. Is it okay?
Yes, doctor.
Okay. Tracy, there are two methods of termination of pregnancy. Either we can go for medical management, which can be a good option in your case. In this, we will give one tablet, which is called as mifepristone, and after 24 to 72 hours, you will be given another tablet, which is called as misoprostol. And there are 4 tablets which can be given, and they can be inserted vaginally or they can be taken orally. You may have a little vomiting, you may have little abdominal discomfort and diarrhea because of this medications. If you vomit within 2 hours of taking this medicine, then you have to report. You may need a repeat dose.
Mm-hmm.
And it is 95% successful. And the other method is we can have a surgical termination. In this, you would be admitted in a daycare unit, and under the effect of some medications to make you sleepy, we can give you under the effect and this will be performed surgically. So there can be some complications of surgery in the form of there can be a damage to your womb or the neck of the womb, and you may have some anesthetic complication. Uh, what is your views about it?
Doctor, I don't want any surgery on me, doctor. So it's better I can go with the tablets.
Yeah, so I will be prescribing you these tablets. And Tracy, I would once more recommend that you inform your parents. But it is totally your decision, whatever you do. But it is, I would suggest that way. But ultimate decision will be yours. And these medications I will be prescribing you. And after 3 weeks, we will be doing a pregnancy test to see that it is that the termination is complete, and you will have your next menses uh, uh, at the right time or maybe a little later. So if you do not have your periods after 4 weeks, then you may again report. Okay. And in case you have any other problem, you may also uh, uh, come and we will fix an appointment. I will be giving you some information leaflet regarding this. And do you have any other problems or you have any other concerns?
Doctor, yes, I want to know one more thing, that does it going to cause any problem like whenever I want to become pregnant again?
I assure you, Tracy, that this is absolutely safe. And whenever you want, you may, there will be no difficulty in conceiving, but I would recommend some safe sex practices so that whenever you want to become pregnant, it would be in your hands and it would be your decision. So there are certain contraception methods available. I'll be giving you information about them also in the leaflet. So whenever you decide or whenever you start a new sexual life, then you should know these options are available and you can use them accordingly.
Okay. Yeah, sure, doctor. Okay.
Is there any further concern, Tracy?
No, doctor. No. Thank you.
And thank you, Tracy, for your time.
Yeah, thank you, doctor. Yes, Amita, 20
Yes,
seconds are remaining. Okay. And you know why 20 seconds are remaining? Do you have any idea why the time? Actually, it's difficult to complete this session in time actually, but why you have completed before time?
I missed on certain things.
You like once you asked regarding the sexual history, then you just went on talking regarding the examination and this thing. You you forgot to ask regarding family history, regarding social history. You have to ask for her blood group if she knows it or not.
I was anxious. Yeah.
Yeah.
Okay.
Any medical history? Okay. Surgical you asked, but medical I think you forgot.
Yeah, I was a little
Yeah.
apprehensive.
Yeah. And that's why you were knowing everything. Actually you know how to counsel, but because of I think you was very anxious or stressed out. That's why you couldn't this thing. You started on the correct note actually. Management also you started on the very correct note. And the previous history what you took was correct. So see in this young girl, she is 15 years. Okay. So always start in these 15 years. First assure her confidentiality, because see here the line in the see there is nothing given in the station that is without some meaning. Okay, they just don't give the information just like that, correct? So here they have specifically written she is very firm that her parents should not come to know about this. Okay, so here, whenever she comes to you, so Tracy, start her history with, so Tracy, how are you doing? Okay, how is your, what you're doing? How is the school going on? Okay, so try to
Yes,
take
ma'am.
her into the confidence. In young girls, always remember that whenever you start the station, no, just ask her 1-2 sentences like that and take her into confidence. So Tracy, how are you today? How is the school going on? Okay. And yes, Tracy, I have come to know from your letter that you don't want this any information that that your parents should know. So remember, Tracy, here that whatever is there, whatever the conversation between you and me, that will remain confidential. Okay, and I'm not going to share it with anyone unless you give me permission to do so. Okay, so this will be the your first sentence before starting her history. Otherwise, she is going to nag you on that only. Okay. So first
Yes.
take her into the confidence regarding this. You same way you told, but yes, you told it afterwards. Okay. So in the beginning only take her into the confidence and ask regarding her school and something like that, so that she will have a confidence in you. Okay. And then she will tell them, because you have first started with the partner and this thing, no, so she becomes somewhat apprehensive. Then she is not going to tell you correct history. Okay.
Ji.
Got it?
Yes.
Yeah.
Yes,
Yes.
yes.
Okay. Now, so first thing is ensure her confidentiality. Now, next thing, yes. So, you are pregnant, Tracy. So, who knows about it? That you asked very correctly. Who knows about it? So, she told yes, nobody knows. So, yes. What about your partner? So, he also doesn't know. Why he doesn't know? Okay. So, why? Is there any specific problem, Tracy? Why he doesn't know regarding this pregnancy? Then she will tell you that yes, she had a recent breakup. So yes, may I know the age of your boyfriend? So definitely rule out any sexual abuse or child sexual abuse. When the age gap is more than 3 years, then you have to inform this thing regarding this child safeguarding. Okay, below 18
Yes, ma'am.
years. Yeah. So yes, that you ask for the partner age and you ask it. Yes. Does this sex happen with your consent? Okay. That
Okay.
also you have to ask. Okay. Now, next thing is, now she told you that she is pregnant and all these things, 6 to 7 weeks and all that. Now, next thing is rule out this STIs also. So that you asked twice actually, in fact, any foul smelling discharge and this thing. What contraception she was using, you asked it very well. Assess her family background also. Yes. Now you don't argue with her regarding why she doesn't want to tell her parents. Okay. Okay, I accept your wishes. Okay. So yes, you
Yes,
don't
ma'am.
want to inform your family members. Okay, Tracy, I can understand. Yes, you feel scared to tell your parents, they might scold you. I can understand these problems. So yes, but can you tell me who are at your home? Okay, who are at your home? How is your family relations? Hmm? To rule out any domestic abuse or something like that. Okay.
Okay, ma'am.
Hmm.
Ma'am, she
Now
did
once you,
mention that their parents are very strict and they will throw her out of the
yes,
home.
yes, they are strict, but how your relations at home? See, she thinks that her parents are strict, correct? She thinks that her parents are strict and they will throw out of her home. She thinks that. Okay, but now you have to ask her how is your relation, family relation. But then she can tell you that yes, my parents, they are good only, but once they come to know that, they will be furious. Okay. Yes.
Yes.
So it's not
Yes.
that it is abuse or something like that. Okay. Only thing, they are strict. So that's why she doesn't want to she doesn't want to tell them. Correct? So now don't argue with her that tell your parents or something like that. I will tell you how you can do it later on. Okay. So,
Okay, ma'am.
okay, Tracy, now complete the history template, like all the family history and social history. You have to ask regarding smoking, alcohol, and all these things, correct? And blood group if
Yes.
she knows. Otherwise, you have to do this test, correct? So we have to do some basic test on you before doing any abortion. You have to do that, correct? At least for blood group. Now, next thing is examination part. You have to tell, and if required, I will take some swabs also to see for any sexually shared infection. Okay, whenever you tell regarding examination for these young girls, always tell regarding STI screenings. Okay,
Yes,
I may
ma'am.
take some swabs. Okay. Now, next thing is once now you have to give her all information regarding what are the methods of available. Now you started with this methods directly medical abortion. Okay, so Tracy, do you have any idea how? And one more thing here, you have to see why she wants abortion. Okay, have you ever thought of continuing this pregnancy, Tracy? Okay, give that option also. Have you ever
Yes,
thought of
ma'am.
continuing this pregnancy? Okay, so if something has in her mind, she will tell you, and then you can offer the options of adoptions, correct?
Yes,
And
ma'am.
social services to her, if it is there. Now, yes, she wants abortion. Once you are sure, then yes, Tracy, I will tell you there are two types of method. But have you any time heard of these methods, or have you in your mind regarding some methods that you want something? Do you have any idea regarding that? Okay, if she doesn't tell that, so if you ask this, I will tell you that yes, I want tablets. Okay, I know that it can be done by tablets. So you have to tell regarding the medical method then, correct? Because you can't tell both medical, surgical, and all these things in 10 minutes station, correct? Advantages, disadvantages of each of the things and her history, you can't complete in 10 minutes. So if first ask her, do you have any idea regarding how you can do this abortion? Okay. So now, if she tells you that I want tablets, or I will prefer tablets, then you have to tell more regarding this medical abortion or else surgical abortion. Okay. And now the medical abortion, what you have told, very correct. That is first mifepristone, then misoprostol, or you can give it at the same time also for early pregnancy. And you will get the bleeding, and you will have some discomfort. You may have bleeding till 3 weeks also. Okay, and then you have to do the pregnancy test and all these things. Now 95% effective, that means there are 5% chances that she may require surgical method, correct?
Yes,
Sometimes
ma'am.
abortion not complete with this tablet, and sometimes you may require surgery. Surgery means we will remove this pregnancy tissue with the help of a suction apparatus, plastic suction apparatus. Okay. So it is a small surgery only. It is small operation only. We can do it by numbing, by giving injection to numb your neck of the womb, and we can do that, or we can put off you to the sleep, and we can do that. But there are some complications of this operation also, like injury to the neck of your womb, or sometimes there may be some hole inside your womb, and sometimes there might be some excessive bleeding also, heavy bleeding. Okay, or sometimes after surgery also there are 5% chances that you may have to undergo again one surgery to remove the remaining pregnancy tissue. Okay, that is incomplete surgical evacuation. So in case such things occur, Tracy, whom do you think that you should tell? Okay, if in case if such complications, these complications are very rare, and we will take all due precautions to avoid this, but still in some cases such things occur. And if such things occur, whom we should inform, Tracy? Have you ever thought of this? Okay,
Yes.
Got it? So how you can inform the parent? Okay, how you can tell her regarding informing the parents. So if such complication occurs, there should be someone to support you. So have you ever thought of such things? So in that case, whom we should inform? Okay. So please think over this also, and I think it's better to inform your parents or if someone elder, because you know our parents are the greatest strength of us. Definitely they might be angry or they may scold you, but in all bad situations, they are the only pillars which support us. Okay, but don't tell these sentences in the beginning. It will be preaching, correct? Okay, if you tell this in
Yes, ma'am.
beginning, it will become preaching. But once you made her aware of the complications, then she will also think seriously on it. Okay, and then she
Yes.
can tell you, yes, I will think of it, telling my parents or someone. Okay. And one more thing, she is 15 years, correct? That means she is under 16. You have to assess her competency. Okay. And how you're going to assess her competency is whenever you are informing her regarding these methods, correct? Like medical or surgical methods. So you have to see that whether she understands it, retains it, weigh between two methods and take the decision. Correct? So yes, Tracy. So can you please tell me which method will be suitable for you and why? Okay, this thing you can ask, or you can just ask her simple questions. So yes, Tracy, can you tell me when you have to take the tablets and when you have to come to the hospital again? Okay. So such simple questions you can ask, and you can ask her. So what do you think? Which will be more suitable for you, tablets or surgery, or tablets or operation? Okay. So in that thing, the examiner will know that you are assessing the competence. Got it? Because she is 15 years, you have to do that. You have to assess her gillic competence and only you have to go ahead. Correct? Otherwise, you can't rely on her consent if she is not competent enough. So here you have to assess the competence, and you should make her aware of complications and blood group anti-D. That is the patient safety things. Okay.
Yes, ma'am.
Definitely methods of contraception. So Tracy, in the future, I will advise you that you should follow a proper method of contraception. So you should not land up in such situations again. Okay. So I will refer you to the contraception clinic also. They will give you better information regarding this. And also, please practice safe sex, that is use condoms, so that you should not get any infections, any sexually shared infection. Okay, that might cause some problems whenever you want to become pregnant next time. Okay. Yeah. Okay.
Thank you, ma'am. Thank you, ma'am. Thank you, ma'am, for giving me this opportunity.
Yeah, and see, always, yes, here people have so many things they have written here. So red flags, pain, bleeding. So all complications you will tell. Okay, when to report the hospital and when to this thing. So you have to tell. Two doctors' opinion is needed for termination. Yes, my dear, two doctors' opinion needed for termination. But when she decides regarding that, when she decide for that, okay? Yes. So any doubts? So clear. Not at 7 weeks. See, for surgical abortion, whenever you are doing any surgical abortion, consider anti-D. Consider anti-D. Okay. For medical abortion, no need to give anti-D, but for surgical abortion, you can always consider after 10 weeks offer. Okay. But for surgical abortion, always consider anti-D.
But doctor, it is written that the medical or the surgical termination require the NTD, but in the case of spontaneous miscarriage, no need of NTD.
For medical abortion, less than 10 weeks, no need of NTD. According to new guidelines. For medical abortion, less than 10 weeks, no need of NTD. For surgical abortion, consider NTD, and above 10 weeks, medical surgical for both give NTD. Two doctors' opinion is required for all abortions. For all terminations, two doctors' opinion is required unless it is a emergency which involves a grave injury or grave risk to the mother's life. In that case, you can do with one doctor's opinion. Otherwise, for all terminations, all abortions, you require two doctors' opinion. Okay.
Excuse me, ma'am.
Hemoglobin, yes.
Yeah, ma'am. I just wanted to ask one thing. Actually, this patient, she had a breakup 1 month, few days back. So
Yeah.
shouldn't we do like was this was this pregnancy because of some was she forced for some for this sexual intercourse?
That's what I asked, no? So always ask whether the sex was with your consent, okay? Always ask her.
Yes, ma'am.
Always ask her whether whether the sex was with your consent or not, okay? For any childhood, this thing.
Yes.
Dr. Mrudula, even for medical termination of pregnancy also we have to take two doctors' opinion or only for surgical procedure?
According to me, for any abortion in UK, you require two doctors' opinion until it is a very emergency, a risk to the mother's life. Okay. Otherwise,
Okay.
for each and every termination, you require opinion of two doctors. Please, anyone of you have any reference that up to 12 weeks, one doctor's opinion is required, please share on the group, okay? But according to me, for this thing in UK, two doctors' opinion required, okay? It is in India, up to 12 weeks, one doctor, up to 20 weeks, two doctors' opinion, it's in India, okay? But in UK, for any abortion, two doctors' opinion is required.
Yes, for clause F and G, I think single doctor is required.
What?
Clause A
F
to
and
E.
G, yeah. Yes. F and G means where there is a risk to mother's life, then single
emergency.
doctor opinion is sufficient. Otherwise, for any abortion, two doctors' opinion is required. Yes, how to assess her? Okay. So see, how to assess for competency means you are assessing for Gillick's competency for doing any procedure. Like you have to assess her whether she can give the consent or not. And for any consent, what you have to check is whether she can understand. Okay. Whether she can understand the treatment, what you are offering her, whether she can retain that information, okay? Whether she can weigh regarding the pros and cons of these options and take the decision. So all the four things you have to tell her. That means you are going to tell her regarding the information of medical and surgical abortion. You will see whether she remembers anything of that and whether she can decide between the two which she wants to undergo. Okay? Clear? Any other doubts? Okay. So we will conclude the our session today. We discussed 3 sessions. So yes, we are doing this course from the next like July 1st week, okay, and 2 batches. Almost only 2 seats are remaining. Otherwise, they are full. So if anyone is interested, please message us. And yes, we will be doing these 3 sessions regularly. So don't worry regarding that. Okay. Okay, then bye. Thank you all for your time, and thank you Razia, Amita, and first one who is in Shraddha. Yeah, all of you for doing this station. Thank you.
Thank you, Mrudula.